epidemic of a disease. We have learned about how diseases spread. Diseases spread rapidly through various mediums. For example, germs of diseases like influenza, conjunctivitis spread through air. Hence, many people get affected by these diseases all at the same time. Diseases like jaundice spread through contaminated water, and all the people who drink this water are in danger of getting affected by jaundice. When many people in one area get affected by the same infectious disease all at the same time, then we say that there is an epidemic of the disease. Recently, in the last few years, we all have faced a very dangerous epidemic. Can you name the disease? Correct. It was Corona. Do you remember which precautions we had taken during the period of the epidemic? We used to wear masks, wash and clean our feet and hands, keep distance during conversations, wash and clean vegetables and fruits and so on. But children, be aware that we must take precautions always as we did during the Corona epidemic. If we take precautions to ensure that germs do not enter our food, water, air and prevent the breeding of germs which spread diseases, then we can prevent the spreading of diseases. This is called as prevention of diseases. Let's learn more about the prevention of diseases. Prevention of diseases that spread through water. Water is purified at the water purification centers or waterworks. Bleaching powder is added to community sources of water to kill the germs. Even then, when there is an epidemic of gastro or jaundice, people are advised to boil water before drinking it. Prevention of diseases that spread by insects. Take precaution to see that there is no stagnant water in your surroundings because mosquitoes breed in the stagnant water. Use insecticides to prevent the spread of diseases like malaria. Cover your mouth while coughing and sneezing. Avoid spitting in the open. If it is necessary to be with such a patient, wear a mask to cover the nose and mouth of both patient and persons with him or her. Let us learn now what precautions must be taken if a person gets affected by an infectious disease. Tuberculosis is an infectious disease. A person who is affected by tuberculosis suffers from severe coughing. The person who is affected by tuberculosis is quarantined. Even in the hospitals, there are separate wards for the patients suffering from infectious diseases. Clothes and utensils used by the patients are washed with germicides. The spittle of a person who has tuberculosis is collected in a vessel and covered with a germicide-like phenyl. Such precautions help to prevent the disease from spreading to others. Don't forget to inform the government health department if someone in the family gets affected by an infectious disease. Vaccination is another way to prevent diseases. Let us learn more about it. Vaccination. Vaccination against a certain disease means to develop the ability of our body to resist that disease. You will remember that to prevent corona, all people from children to adults were vaccinated against it. This is one more method of preventing diseases. The vaccination begins when we are babies. When a baby is born, she is immediately given the tuberculosis vaccine. When the baby is 1.5 months old, she is given vaccinations against diphtheria, whooping cough, tetanus and polio. 2 more doses of these vaccinations are given at intervals of 1 month. The vaccinations for diphtheria, whooping cough and tetanus are combined into a triple vaccine and given as an injection. The polio vaccine is given orally. Thus, the measures of prevention of diseases begin when we are babies. Children, as we take measures of prevention of diseases at the personal level, similarly, we must take some precautionary measures at the public level too. Come on, let's learn more about it. Public health service facilities. To prevent the spread of infectious diseases and epidemics, health and community welfare programs are undertaken at the national level. Some of them are as follows. Community programs for vaccination are undertaken as part of national health schemes. Special camps are arranged for this purpose. Children are given the vaccines by trained people. Primary health centers have been established at the village level. There are also facilities like mobile dispensaries, ambulances, and a welfare fund for the disabled. Services like the examination of urine and blood, X-ray, sonography, and other scans are also available through the health programs. People are also educated about the right methods of handling drinking water and food. They are urged to maintain cleanliness in their surroundings. It is now forbidden by law to spit in a public place. Mass media are also used for raising public awareness about health and hygiene issues. Children, there are some misconceptions about diseases in our society. At one time, it was believed that diseases are caused due to the anger of gods, evil spirits, or even due to black magic. The remedies prescribed for these were also inhuman. However, scientists have proved through their research that these beliefs are false and diseases are caused by microorganisms. But we must keep in mind that though diseases are caused by microorganisms, all microorganisms do not cause diseases. Some microorganisms are useful to us. For example, the conversion of milk into yogurt takes place due to microorganisms. What did we learn? Measure to prevent the spread of diseases. When many people in one area get affected by the same infectious disease all at the same time, then we say that there is an epidemic of the disease. Vaccination is an effective measure of prevention of diseases. Appropriate measures are put in place to maintain public health. Exercise. There is an epidemic of jaundice in your town or village. How will you take care of yourself and your family? You are affected by flu. What precaution will you take so that other people do not get affected by the disease? In your opinion, who is responsible for the public health? Is it the responsibility of the government alone, or is it our responsibility too?